Hello, everybody, and welcome to another session of dental shadowing. Today we have pediatric dentist Dr. Reem with us, who's going to give us an awesome session and talk a little bit about her ownership in a practice, as well as her being a pediatric dentist. So, Dr. Reem, you can go ahead and take it away.
Awesome. Thank you so much, Hannah, for having me. I'm so excited to share my journey with you. And I remember being in everybody's shoes, so I know how, resourceful and useful these things can be. So I work at Tyson's West Orthodontics and Children's Dentistry. It's me and my father's practice. This is our information and this is my email. I'm very big on open communication. If anybody has future questions later on or any shadowing opportunities, if you're in the area, please feel free to email me. I do have an Instagram page at Dr. Kids Teeth, and I do YouTube videos on just like pediatric dentistry catered for adults and that have kids basically for their children. All right, so let me start out by just telling you a little bit about myself. This is the first picture. It's me and my husband. We're very big on traveling, and then COVID happened. I'm big on traveling for service as well. I take a bunch of dental students, NYU dental students, every year, and we go to different, I go with the NYU Global Outreach Program, and we go do dental service all across the world. We've been to Nepal, Cambodia, Grenada, and it's something that I truly enjoy. It combines like my love for traveling and my love of dentistry. So I always encourage anybody out there to go out, venture out, learn about the world. I'm pretty big on that. So let me tell you about how my journey started in dentistry. So I started at George Mason University. That's where I did my bachelor's in political and persuasive communication and a minor in business. So you could see very non-sciencey. Of course, I still had to do my pre-dental, but it definitely was not a science major. And then I went and continued. Decided to go to my state school, the only state school in Virginia, Virginia Commonwealth University. And that's where I went to dental school. And then I decided I wanted to get out of Virginia finally, and I went to NYU, also Bellevue Hospital, and that's where I did my pediatric dentistry specialty. And then I went on to continue to be board certified by the American Board of Pediatric Dentistry to become a diplomate. Alrighty. So often people tell me like, well, how did you choose like pediatrics out of all the other specialties? For me, I've always known I've wanted to be a dentist. Definitely having a father being a dentist kind of played a role on that. Just growing up, I always saw how he was with his patients, how much they appreciated him. And it's just something that I decided I wanted for myself. I've always loved science. And I just love that so it was medicine or dentistry for me. And what I really love about dentistry is that balanced life, that you still have the office life where it's not like on call crazy hours, like maybe like our medical colleagues. So I really like that you have the balanced life. And then with kids, it's just, kids are so much fun. You can be silly, goofy, and it's just, they're just so innocent and they're hilarious. They really make my job so much fun. Also, just like that, when you have a fearful child come in and they're super anxious and they're so scared, and then when they eventually trust you after you try all these different methods, it's such a gratifying feeling, and I love it. And I love watching them grow over the years too. And it's just not boring because every kid is different. Every day is different. There's no predictability in it. And I love that. It just makes it challenging for me, which I love. It's just every day is a new challenge. That's why I chose pediatric. So prepping for that acceptance letter. I know that's what everybody wants to talk about, right? How to get into dental school. I remember being in your shoes. And this is how I always pictured it. There's things that are easier to control and things that are harder to control, right? So I always say, focus on those things that's in your hands, that's super easy to control. So what are those things? So when I talk about the different pre-dental requirements, I'm going to talk to them. I'm going to kind of categorize them in those two categories. So you're going to have to take courses in biology, general chemistry, organic chemistry, physics, math, right? All these are pre-requirements. So I always say, don't take the minimum, These are things that you can control. Make your application look good. So like, even though I was not a science major, right? I was a communications major. I didn't just take the minimum. Like I tried to go ahead and take a genetics class. Like I tried to show that I'm capable of doing higher level science classes and still do well. So I always say, don't do the minimum. Don't just do the pre-dental requirements. Of course, if you're a bio major, you're going to definitely go above that. But if you're a non-science major, and then the 3 letters of recommendation, I always say that's also something that you can control, meaning like it's easier to control. So for example, if I took a class with a professor and I went to probably see him one time that whole semester and I got a B, I'm not going to ask him to write me a letter of recommendation, right? So really choose that wisely. It's easy to think about those things. It's easy to build those relationships too. So like for me, like I took a communication as my major. So there was a professor that I always like took classes with. So I made sure I went after hours. I built a personal relationship. So when the time for that letter of recommendation, I asked, could you write me a really good letter, right? Anybody could get a letter. It's not just about doing that task. It's about getting a really good letter. And guess what? They will write you a really good letter when they know you. But when you're another number in that huge classroom, you're just going to get a mediocre letter of recommendation. So that's something easier to control. Your GPA, I would say that's also a little harder to control. Some classes can be harder, right? So do your best, right? Do your best and show progress. Like people always say, but what if I didn't do really good in my freshman year, but then junior year and end of my sophomore year, my grades got better. That's important. Progression is so important. So I always say, like, don't give up and say, I'm never going to get in. Like, I did so bad. I have a C on my application. They know that you were 18 when you first, started college, and you're growing as an individual and you know what you want. Just prove that you're getting better. Now, the DAT, that's one of the tougher ones, but I always say that it's just practice, practice, practice. Eventually, when you do so many of them, it's the same pattern. I personally love the DAT Destroyer. That really helped me. And everyone's different. Some people really don't need that classroom setting. So they did, classes like Kaplan. So that you might find that helpful. But then again, some people are like, I just need to study on my own. I just need the material. So I think that's personal. Everybody, yourself. If you need somebody that's really going to get you on that schedule, maybe a course is good. But if you just sign up for a course and you invest your money in it and then you don't give it your 100%, then it's really a waste of time. And then like being a well-rounded individual, I always say this, like there are people that have like a really good GPA, everything looks great in terms of numbers, a great DAT, but then you see them and they can't hold a conversation. They don't do anything other than study. They're not in any clubs. They have no leadership qualities, no shadowing qualities, nothing, like no shadowing experiences. Do you think that person will be a good healthcare provider? I mean, you're talking to your patients every day. You're trying to motivate them. If you don't have that, you're not going to be a good healthcare provider. And they see that in the application. They don't just want a robot. They want a person. They want a human who's compassionate, who has, motivation and whatnot. So that's really important. And I don't necessarily say it has to be a certain thing. It can be anything you're passionate about. If you're in a cultural organization, if you are in a church group, if you are whatever it is, you just take a leadership role, show community service, show that you're a member of a community. So that's really important. Research is a plus. I remember I ended up doing research my junior year, and I know some universities it's harder to get, but it does open up your mind and it's a good experience. I personally hated it, but it did look good on my resume. So just throwing it out there. All right. And then they're just like something to just think about, your dental school education requirements. And that's not something you really have to worry about. I hope when you apply, you only apply to accredited schools, just throwing it out there. So just always make sure you're going to an American Dental Association school that's accredited by the American Dental Association. And like I said, you have to do your pre-dental education, meaning you don't necessarily have to have a bachelor's degree, but I always say it's really like silly not to. You might as well just take a few classes and get that. And also something to fall back on, not that you wouldn't get in and not apply the following year, but at least, you have something to do, or just something as a degree. I think it's important. And then once you finish dental school, in order to practice, you have to do an exam to receive the license, and each state is different. All right, I'm just throwing fun dental facts out there just to change it up a little bit. So teeth, I always like to say, it's the hardest substance in the body. It's harder than bone. So remember, enamel is the hardest thing in your whole body, all right? And you know what the enamel is? It's the outside layer. Just a fun fact. All righty. Okay, so during dental school. So in dental school, it's basically 4 years. You're taking didactic courses from gross anatomy to neurology. You're taking microbiology, biochemistry, pathology, physiology, histology. So you can see why those pre-dental requirements are important, because that's the way the school can know if you actually will be able to perform well. So if you're not performing well in your biology classes in undergrad, that shows us that you're probably not going to be able to do well in dental school. So that's why they want to see that you could do good in those classes. That's why those classes are important, because you're going to need to take higher level classes when you go to dental school. And then you also have clinical sciences. So it's a lot of lab work where you learn how to hold a handpiece and do preparations and all the dental techniques. The last 2 years of dental school, so your third and fourth year, you're mostly treating patients in the dental clinic. You're obviously supervised by a dentist, but that's really where you learn all your clinical skills. And then once you graduate, that's when you get either your Doctor of Dental Surgery, your DDS, or a Doctor of Dental Medicine. I know a lot of people ask what's the difference. It really is the same. It really doesn't matter. It's just different schools have different degrees. Alrighty. So most dentists, when they graduate, they practice as general dentists, but then you have 22% of dentists who decide to specialize, and those are the recognized specialties of the ADA. You can be an endodontist, so that's a root canal specialist, an orthodontist, to straighten teeth and braces, oral pathologist, and those, they work closely under the microscope, and they basically receive all the biopsies from all the dentists, and they give us a good diagnosis. Then a pediatric dentist, you have an oral and maxillofacial radiologist, and then you have an oral surgeon. You have a periodontist, so that's like the gum specialist, prosthodontist, so they do a lot of the crowns, bridges, all that, and then a public health dentist. So 9 different specialties. Actually, I didn't include it in here, but you can be a dental anesthesiologist, and that's now a recognized specialty as well. Alrighty, so fun fact. The average human produces 25,000 quarts of saliva in a lifetime. That's enough saliva to fill 2 swimming pools. So look at that sublingual gland, those submandibular glands. You really form a lot of saliva, and that's what protects our teeth. Alrighty, so what's pediatric dentistry? A lot of people wonder, like, do kids really have cavities, and why is there a specialty? So really, pediatric dentistry is all the comprehensive care, meaning preventative and therapeutic oral health care for infants, children, all through adolescence, and that includes special health care, meaning kids with autism, kids with complex medical histories, cerebral palsy, Down syndrome, all that. So you end up learning a lot about those special needs, conditions and syndromes, so you can better treat that patient. And remember, to become a pediatric dentist, you have to complete an additional 2 to 3 years of specialty training after you finish dental schools. And that's just so you focus on the oral health needs of the children and the special needs. And I like to include that picture because sometimes I get that question a lot, like, could they get really bad, the cavities? I mean, look at that. That's pretty bad. We had to remove that tooth because it was causing the child so much pain. Alrighty. I won't bore you too much with this. This is basically all the things that you learn in pediatric dentistry in your training. Basically, you do a lot of non-pharmacological behavior guidance techniques. That means like you learn how to not use medications to do behavior guidance. So like how to get the children to do what you want them to do. There's a lot of different methods. You learn a lot of child psychology and how to deal with kids. There's like so many different methods. We also use pharmacological behavior guidance, such as nitrous oxide, the laughing gas. We use that a lot. You can see it in the picture. It really helps because it's not only an anxiolysis, meaning it helps with anxiety, but it also has an analgesic effect. It actually also has a numbing effect too. So we do use it a lot with kids. Then you can even go up a notch and use oral conscious sedation, where we use actual medication to sedate kids so that they don't remember, and it really sedates them. This works. It's not very strong, so it works not all the time, but it's definitely one of those methods that we use. Then you have general anesthesia, and that's when kids are completely put to sleep, just like you would for any surgery. And we do that with the anesthesiologist. You could do it in office with an anesthesiologist, or you could go to the hospital. I do it at Inova Fairfax Hospital for my more complex cases, and I also have an anesthesiologist come in the office where we do it. So I did my training there at Bellevue Hospital. And then you learn how to deal with acute dental trauma, like, a child falls, they have their permanent tooth. What do you do? All of that. Then you also, like I was telling you, special health care needs, how to deal with kids who have cancer and blood disorders, so hematology and oncology consultations. And then also management of patients with craniofacial anomalies, right? So all these kids who have different craniofacial anomalies, they have a lot of missing teeth, their mandible is not formed properly. There's so many things that you have to consider when treating those patients. And then also orthodontic treatment, meaning starting that a little early rather than wait where all their permanent teeth are there. And then silver diamine fluoride, which is like a medication that we use to basically stop the cavity from getting bigger until we can you're basically buying time until you can do more definitive treatment. Alrighty, so career after residency. So once you're done with residency, you can finally work, and there are so many different paths. A lot of dentists are just solo practitioners, meaning that they have their own business and they have their own office. Some dentists have partners, meaning they have associates. So like I could be like a pediatric dentist, and I open up an office with with a friend or a colleague who's an orthodontist. Nowadays, there's definitely more a direction towards multi-specialty practices. And before you would see just a general dentist on its own, and then a pediatric dentist on his own. Now you see more specialties coming together into one practice, just because it's more convenient and having everything in one roof. Most dentists, I would say, work 4 or 5 days a week. That's what's really nice, is you have flexibility of your schedule, so you really get to choose what you want. Some people work evenings, weekends, like you choose your hours basically, and you kind of see what meets the patient's needs and what meets your family needs. And that's one thing I love about dentistry, just the flexibility of your schedule if you own your own office. So full-time dentist, I would say, works about 35 to 40 hours a week. Most, and it really depends. Like when I first started, I was working all the time, right? And then once you build up a patient pool and you have a more steady schedule and whatnot, then you can cut down your hours a little bit more. But in the beginning, you're going to hustle hard. And it's really common for dentists to continue part-time practice well beyond their retirement age. Like you'll be surprised, you'll see like people that are still practicing at 60, even 70, because they love what they do. So it really is up to you when you want to stop. And then you can also always teach in a dental school part-time. A lot of dentists do that if you have a local school nearby. It's really rewarding. That's part of why I do the NYU outreach program, is I get to interact with the students, and it's really fun to be in that academic environment. Alrighty, I thought that was a pretty cool fun fact. The first electric toothbrush first appeared in 1939. Can you believe that? Alrighty, so what does a day in a pediatric dentist's life look like? You're doing a lot of oral and head neck exam. You're performing obviously an oral evaluation. You're looking at everything in the mouth, from the tongue to the cheek to the palate, and also the neck. You're looking at cysts. You're looking at the thyroid. You're examining and interpreting radiographs. You're looking at different types of x-rays. Sealants are a protective layer that we put on teeth for prevention. You're administering anesthetics, so that basically you're numbing the teeth before you remove decay and restore cavities. You can extract teeth. You can even, baby teeth. You see all those pictures right there? That's, unfortunately, we had to extract all those teeth from a little girl because they were all decayed and had infection, and they were really bad shape. You can prescribe medication for infections or oral pathology, like if you see certain ulcers or viruses, you can also prescribe for those. We take impressions of teeth so that we can make appliances. Sometimes if somebody's missing the permanent, their front teeth, we can do like a replacement for that until they can do implants, and then also maintain the space until the permanent teeth come in. And then we also treat special needs children. Alrighty. So this is what we call a panoramic radiograph. We usually take it at 7. And the reason why we take it is because we get to see all the different, all the teeth. We get to see what's missing. We see that, we count how many teeth they have. We look at if there's anything abnormal, like in the sinuses. We look at the mandible. We look at all these different structures. You can actually see this huge cyst over here. This is what we call an OKC. You get swelling, and it's so this is why it's really important to look at pathology, to take these x-rays. It's not just looking at teeth. There's a bigger picture. Alrighty. Egyptians used a form of toothpaste over 5,000 years ago. I thought that was really cool. And you could see them in their drawings, which I found was neat. Alrighty. So when I was talking to you about sealants earlier, this is what a tooth without a sealant looks like. And then this is with a sealant. So you do that prevention. So you really have that smooth layer. And when we restore cavities, sometimes you could see it visibly like this, and sometimes it's not visible. That's why we take an x-ray. And right here, you could see the difference once it's restored. And then looking over here, this is just, we don't do that pediatric dentist, but I thought it was cool to show you how implants are. And that's mostly like the prosthodontics will work with a periodontist or oral surgeon to place those. Alrighty. People always want to know this, so I'm just throwing it out there. It's so variable, honestly, what your salary is going to be. If you're an owner versus an associate, how much you work. I definitely say as a specialist, that's an average, but you could definitely make way more than that if you have your own practice. And then it depends on how many practices. It's really what you make out of it and what you decide and how much you want to grow. All right. I just want to talk about the future of dentistry. Like a lot of the times now people, worry about debt, and, it's gotten so crazy and with dental school. But I always say, like, if it's something you really want to do, it will be worth it. You will be able to pay it off, but be smart when you're in dental school. Like, do not spend your loan money like it's just you own that money. Like, be really frugal and be smart about how you spend it. But it'll all be worth it if that's what you want to do. And it's very prevention focused now. So before dentistry was more aggressive and we filled a lot more and did more surgeries now where we try to really focus on prevention, which is pretty amazing. And there's so much new technology like the CAD CAM, the computer aided design and manufacturing. It's really amazing how dentistry has gotten so much better with technology over the years. Alrighty. And did you know a sneeze zooms out of your mouth at over 600 miles per hour? I thought this was very relevant for COVID, and this is why we wear masks, right? Because when you sneeze, you could definitely get that way across. That's why the whole social distancing is important. All right, so I decided to just show you a few cases and just kind of show you how a pediatric dentist looks at cases, how the thought process behind it, and what we look at really when we're looking at different cases. Alrighty, so this is the first patient, YA. He's a 7-year-old, 7-month male. So age is very important. Even the month is very important. So he came in for dental rehab in the OR, so in the operating room under general anesthesia. His mom stated that she's not sure if he's in pain or not, but he has bad breath. That was her chief complaint. So just to give you a little background, every patient that we examine, we always look at them in these 4 different aspects. We look at the medical history, we look at the birth history, we look at the dental history, and the social history. All that together really gives us a clear image, because you could have the same clinical cavities in the mouth, but we would treat it differently based on these aspects. So this patient, his medical history, if you look at his review of systems, he has GERD, he has G6-DP deficiency, he has anemia, he has laryngomalacia, which is like, it creates airway obstruction. He has auditory neuropathy spectrum, cerebral palsy. So he has a very complex medical history, which is one of the reasons why we decided to take him to the OR under general anesthesia, because in cases like this, we don't want to use sedation because we can't really control the airway as well. So he's not taking any medication, no allergies, no known drug allergies, and all the immunizations were up to date. ASA is a form of classification. So we classify each patient as 1, 2, 3, 4. So he's a class 3, ASA class 3 because of his complex medical history. His birth history, he was a twin, born in 37 weeks, C-section. Birth history is also very important because they could have trauma during birth where they get intubated, and that could affect also things in the mouth. And dental history, we also look at, does he have like what we call a dental home? Does he always come to the dentist? Or is it, he comes every few years? So first dental visit was 3 years of age. He's born in New York, he brushes once a day occasionally, and he drinks fluoridated water. So we're looking at all those things. Social history, he takes a lot, we say high and frequent intake of cariogenic foods. Cariogenic foods means just like foods that cause cavities. And then the mother denies tobacco smokers in the house. And we always say the word denies because you don't know for sure. This is what they say. So you'll always say it in your documentation, like they denied this. All right, so these are his pre-op photos. So you can see over here, these are his permanent teeth. I could tell by like these little mamelons, like these little squiggly lines that you could see over here. So you could see, because he has GERD and he has a lot of acid reflux, like his teeth are really worn down. Like, look at that right here. This is a huge cavity. I mean, this is the gum. There's nothing left of the tooth here. Same goes here from all the acid. And there he has a huge cavity. So there's no way we would have been able to treat that in the operatory chair, which is why we took him to the OR. Okay. So these are his x-rays. These type of x-rays, we call them bite wings. So if you see over here, so once you go to dental school, hopefully, and you learn all how to read these x-rays, you'll learn that like it's all about different shades of gray, and you'll learn how to read these really well. But I could just tell you, do you see how this is Like this is healthy bone right here. It's nice and white. Look how black this is. This is all infection that's eaten the bone away. So because there's no bone anymore, it's black, it's radiolucent. So like this whole tooth is infected, and if you keep this tooth, they'll infect this permanent tooth right here. So that's why it's really important, to remove this tooth so it's not affecting the permanent tooth right here. Same thing goes on here. Like all these are infected teeth. Here, there's nothing left of the tooth really. It's just a little shell left. So, and even this is a permanent tooth, and I can already see, look how big this cavity is. And the nerve is right here. So even though he's 7 and that tooth just came in a year ago at 6, look how decayed it is. And this is going to stay with him for the rest of his life. And these are different kind of x-rays. We call them PA because we get to see more of the end of the root. We call it the apex, so we can see more of the tooth. So this is, and then we think of all the problems of this patient, because I can't create a treatment plan until I've really diagnosed the case well and thought about everything. So first I think of all the medical, and these are all the things that he had. So I need a medical consultation. I need to talk to the pediatrician to give us any limitations. Maybe they tell us he can't take these medications, or you can't numb with this. Like there's just contraindications that you should be aware of. And then dentally, he had caries, means cavities. So he had a lot of non-restorable cavities, meaning we can't save them anymore. We can't restore them. So they have to be extracted. He had a lot of plaque, which is, that bacteria that's in your mouth. Then in calculus, he had gingivitis, which is gum inflammation. And he had attrition, which is when the teeth are worn down from the GERD, the acid reflux. And then socioeconomic, we always look at like, how's his hygiene? He's definitely extreme high risk just because of his complex medical history. And then he's just a frequent snack. He's a frequent snacker, and he eats a lot of foods with sugar and, cavity producing. Alrighty. So I thought this was another fun fact. Children begin to develop their baby teeth 6 weeks after conception while in their mother's womb. Isn't that crazy how early teeth form? So a lot of times when you see these like teeth abnormalities or anomalies, it's because something happened even at birth. So that's why birth history is also really important, because they're developing as early as 6 weeks. Alrighty. All right, case 2. So meet NA. This is a 5-year-old female. She came in for an emergency visit. She said, this tooth hurts, and she's pointing at her front tooth. And then the pain, so HPI stands for history of present illness. So you just ask about the pain, like, where is it hurting you? When does it hurt? So she was saying the pain is spontaneous. That means it just comes out of nowhere. It's triggered sometimes when she's biting, and mom gave her like over-the-counter medication to alleviate the pain. So for her medical history, she had no significant findings, pretty straightforward. She's an ASA 1, no complications. Her birth history was full-term vaginal delivery. Really, when I look at her dental history as well, the only thing that sticks out is that she only brushes once, usually one twice at least. And then she has pain on her front tooth. And then we also look at social history. So she had an increased BMI. That tells me that, she's probably eating a lot of cariogenic foods. She, mom said she drinks soda and juice frequently. Mom works full-time and denies knowledge of patient's breakfast, so she doesn't really know what she's really eating. So all these things are factors about how, and it'll help me decide how I want to treat it. Sometimes you'll be a little bit more preventative, or sometimes you'll take a little bit more aggressive approach based on all these factors. All right, and this is her. And this is how, when she first came in, this is how her teeth looked. So you can see she's not missing a permanent tooth. She just hasn't had that one erupt. You could see it right here. It's underneath that gum. You could see like visibly, look at all those teeth. So that whole enamel layer, the outside layer, which is the hardest substance in your body, is already completely gone. And I could see her dentin being exposed, all of that from cavity. So see, at such a young age, she has so many cavities, and you could see it again here, right? Look at cavity over here. Look at how broken this tooth is, and here and here. Alrighty. And then we take x-rays, and remember, I'm looking at like the bone health. I'm looking at if there's like bone, what we call bone resorption. I'm looking at how deep the cavity is, how close is it to the nerve? Is it something that we can save, or is it not worth saving? And then we take a panoramic x-ray so we can see where her teeth are. So I can see this is what we call her 6-year molar. That's come in. This is her 12th-year molar. So she's 5. So it's still not out yet, but you could see it form. So it's pretty neat. You could see everything. You could see where that her permanent teeth are still developing over here. So this is just a funny picture of how you're not supposed to take a panoramic x-ray. You should always remove glasses. Never take it with the glasses. Alrighty. So for her problem list, for medical, she didn't have much. Dental, she's missing teeth. She has a lot of crowding. She doesn't have a dental home. Mom kept saying that she was moving from dentist to dentist, so she doesn't really have a place that has all her records, and she hasn't been really followed up regularly. And then socioeconomic, again, she's a frequent snacker, poor oral hygiene, the fact that she's an increased BMI, and she's extreme high caries risk because of all these factors. Alrighty. Yep, so that concludes the second case. So I actually showed you this one already, so we can skip that one. So case 3, and this is the last one. I'll make it quick, but I just want you guys to really see how you think. And like, you know, people just think it's like you're drilling, you know, you're just drilling teeth. It's way more than that. And that's where all the science comes in and why it's really important. Alrighty, so this is JF. He's a really cute boy, 4-year-old, 8-month-old male. He also came in for emergency. This was a trauma case. Mom said he fell yesterday on the playground and he didn't let me brush his teeth because he said they hurt. So he came in. Again, we're doing the same thing where we're looking at medical history, birth history, dental history, and social history. For him, everything was pretty straightforward. He did have a dental home. Also, like, social history is important because, you know, sometimes when I hear like, oh, like he's the youngest child of 7, you know, and mom's working full time, you know, that really does contribute to the child's dental health. You can't always assume, but these things are factors that you look at as well. So these were his pre-op photos. So he fell on his front tooth. If you notice his gum over here on his lower lip, he has also like a blister. And that's from the bite, from the fall. When he fell, his teeth bit his lip. And then he has some ulceration over here. So we always take an x-ray. And even though here you're like, oh, the teeth look okay, they don't look that bad. When you look at the x-ray, I can see, do you see how I can see this red, this black radiolucency? That's a sign of an infection. So same over here, I can see it over here versus this is healthy. And then also when we took this tooth, we found something else. We found when we took this x-ray, do you see how here, these are the 2 baby teeth. So you have one baby tooth right here, another one over here, and then you have this permanent tooth right here, and then this one, and then you have an extra one. And this is what we call a mesiodent. So this over here is basically an extra tooth. So we found out from this trauma that this kid has an extra tooth. And not only does he have an extra tooth between his front 2 permanent teeth that haven't come in yet, but it's also inverted. So it's actually growing the wrong way. It's growing towards his nose versus this way. So this is definitely something where x-rays are so important, where we need to make sure we take care of this soon, and he's probably going to have surgery and remove it in the correct time so that this tooth doesn't get affected, the permanent teeth. Because if this is close to where the permanent tooth, with friction, you can resorb that tooth. Anyways, I won't go into detail with that. Alrighty. All right, and I just wanted to end and tell you how fun pediatric dentistry is. I know this was a lot of technical, and I'm showing you cavities and this, but we have a lot of fun in the office. We love to dress up for Halloween, as you can tell. And it's just like you can make whatever environment you want in your office. So, and then just, become a dentist for the right reasons. And really, when you do it for the right reasons, it goes a long way. You end up loving what you do. When you love what you do, you become really good at it, and you give it your 100%. So if you ask me, is it worth it? Was the hard work worth it? 10 years of school worth it? I would tell you absolutely. And then I'm really big on organized dentistry, and you're not in dental school yet, but when you do, actually as pre-dental students, you guys can be part of the American Student Dental Association. And I'm big on talking about those because those really do fight for our profession's rights. Like during COVID, dentists were considered essential workers, and we were still able to provide treatment and open offices because of organizations like the American Dental Association. For me, it's the Virginia Dental Association as well. So we go every year and lobby for children's oral health as well, so that they can get the benefits from insurances, because we have, we're fighting for their rights. So I'm big on that. And the final advice before I leave you guys, I always say, before you decide you want to be a dentist, you have to shadow in the field before you come in, because you might think, dentistry is great, and then you come and you shadow and you assist and you see it and you're like, oh my God, this is definitely not for me. So please do not go into dentistry and do not start dental school and then realize that this is not something I like, because you've invested so much time and effort at that time. So really take the time to reach out to dentists and shadow and observe. And then really diversify your application. When I say that, is don't just stick to one thing. Be well-rounded. Do some community service, do leadership, and if you're an athletic person, do that. If you're into if you're part of a really random club, an art club that's really specific, if that's what you like to do it. Don't be just focused on the sciences. Be a whole complete person. Be unique. Be you. And then the other thing is apply early for those juniors out there. I cannot stress that enough. Remember when I was talking about things that are easier to control and harder to control? This is something you can control. You can apply early. You already know what they're going to ask you. You know they're going to have that personal statement. You know you need to do the DAT. So have that all ready. When the application cycle opens up at SAS, I'm telling you, your goal should be within 3-4 days you submit that. There's no reason not to do that. Everything should be ready. You're just filling it out, because that will increase your chances. So do it. Don't wait till the end. And the other thing is, if you know you want to do dentistry, don't give up. If you don't get in the first time, it's fine. Apply the second time and third time. I have friends who didn't get in till the third time, but you know what? It doesn't matter. No one remembers now how many times you applied. At the end, you became a dentist. So if that's really what you want to do, don't give up, and always focus on how you can get your application better the next year and keep going. And then the other thing is reach out and learn from those who've already been in your shoes. You don't have to reinvent the wheel. If you want to become a pediatric dentist, reach out to a pediatric dentist. Most people would welcome you and would love to have you come in the office and learn from them, and really just go out there and ask, because with knowledge, you'll be much more prepared, and you'll be able to really have a better application and just have a better outlook on everything. So that's really my best 5 advice that I could give you guys. And before I bore you with more, let me ask you if you have any questions. I'd love to hear what you guys want to know about.
All right, so we have some questions in the chat for you. The first one was, does a child with a cleft palate work with both a pediatric dentist and oral surgeon, or just an oral surgeon?
Oh, great question. So usually what a child with any craniofacial abnormalities, they have a team. So this team usually consists of a pediatric dentist. It could be an oral surgeon or a plastic surgeon and an orthodontist as well. So, and actually, if you're in a hospital setting, which is what I usually say is ideal for those patients, they really should be seen by also a pathologist, a plastic surgeon. So there's a lot of different factors that go into that. A speech pathologist is a big one too.
And then someone wants to know how you really chose your specialty, pediatric dentistry.
So for me, it's funny because my father's an orthodontist, and I always thought that that's what I wanted to do until I went to dental school. And then I realized that I love like the handpiece. I love doing fillings. I love doing extractions. And I didn't want to give that up. So when you go to different specialties, you might just not do those procedures anymore. So I love that I could, with pediatric dentistry, I could still do everything, but I was still specialized in a specific field and that I could be the best at a specific group of people. And I loved that. And also, like, whenever I would have, like, when I had patients cancel in clinic, I would just go to the pediatric department and I would work with kids. And I just realized that I was the happiest around the kids. And it was just always fun for me. And I just loved working with kids. And that's when I knew that that's what I wanted to do.
And then someone says, sorry if you mentioned this, but were you in a hospital pediatric residency? If not, can you tell us what the difference is?
Yeah, of course. That's a really good question. So when I was looking at programs, I was looking specifically to go to a hospital-based program and an academic program. So I was looking for that combination, and NYU has that combination because they work with Bellevue Hospital. So Bellevue was the hospital component and NYU is the academic. I personally thought that was important for me because unfortunately when you're in a hospital setting only, it's great because there's the pros is that it's a lot cheaper. The cons is that you are basically a hospital employee, so you're not getting really that one-on-one teaching as much. Whereas in an academic program, we read a lot of articles, we do a lot of presentations. So I do feel like you learn a little bit more in an academic program. You get that side, but at the same time, you have that hospital exposure where you're still seeing a lot of patients and you have clinical time. So me personally, I think that combination program was exactly what I wanted, and it really helped me get what I needed to get from residency.
And then what is the age range in the patients that you see as a pediatric dentist?
Yeah, so I really see the first patients, I mean, usually we say at age 1 is when I see them, but I've seen, patients come in, they are referred by pediatricians because they have like cysts or things as young as 3 months. And sometimes, after college, they'll still come in because, we have that relationship. Usually I want to say like after, like by age 25, they usually will go and see a general dentist. And then for special needs patients, I see really up to like 35, I would say.
And then what are the benefits of having like another professional like your dad who's an orthodontist working in the same office as you?
Yeah, so it actually works really great, especially because for example, orthodontics, a lot of the age group that we treat is the same. So you get to really treat a patient comprehensively. So I take care of all their dental work that they need, and then whenever they need braces, or I can see they have oral facial growth that needs to be addressed, then I can just refer them next door, and then we're taking care of the same patient within the same vicinity. It really helps because treatment is easier to coordinate, and then the communication between the providers is easier. So it's really nice having specialists in one place.
And then I know you mentioned 10 years of schooling. What would you say to those who are like fearful of pursuing dentistry because of how long it will take?
So the way I think about it is that like I mean when I think about wow, I was in school for 10 years, that sounds crazy to me. But then I'm like, you know what? I was 28 years old when I was done with everything and I did exactly what I wanted to do. So what's another 1 or 2 years? Like most people, let's say, you do a 4-year career, right? Let's say, and let's say you graduate at 22 and then you go in and you work in the workforce and then you figure out like different paths and I remember because I would see my friends who are like working at 23 and have a steady job and I'm still like a dental student, miserable, like in debt, but at the end of the day, you finish and you're like you work right away and you make pretty good money right away, and if that's what you wanted to do, it's worth it. Years will pass by so quickly, much faster than you think.
And then our last question for you is, what is your favorite procedure to perform?
My favorite procedure, that's a tough one. I have too many things. I think I really enjoy doing what we call strip crowns, which are basically like just because young kids, like, bullying is a real thing, and when they have cavities on their front teeth, like they'll come and they'll be like, "Can you fix it?" And then when I do the white crowns and they like look at themselves in the mirror, like, and they're like so happy about it, I love giving them that confidence back. I
Oh,
would say doing fillings in the front.
that's amazing. Thank you so much, Dr. Reem, for this awesome session. That's going to conclude it. So if you have anything else that you want to say to them, you can go ahead and.
Yeah, of course. I just want to thank you so much for having me. And please, if you have any more questions or if you're in the area and you want to, shadow, I'd be more than willing to help out. And you guys could always email me. Okay.